Hi, my name is Tina Lissman. I'm a physician assistant and have been a medical professional for 30 years. I know that in addition to what we know about medicine, what we know about patients makes a huge difference in their well-being. That's why I'm proud to be working at Princeton Brain and Spine Care.
Hello, my name is Dr. Mark McLaughlin. I'm the medical director at Princeton Brain and Spine Care. Welcome to our practice. When you step into our office, I want you to feel like you're joining a family. And that family will take care of you throughout your entire process of getting well. We will stick with you throughout your whole life, not only taking care of your present condition, but also with any future medical problem.
Hello, my name is Dr. Neuralgia. I am a physician at Princeton Brain and Spine Care. At Princeton Brain and Spine Care, we have built a circle of trust, compassion, and skill that is almost unheard of in today's world. The foundation of this practice centers around you, the patient. When you are here, you will be treated with respect, you'll be given our time, and you'll be given the very best of us. That is how healthcare should be. Ideal, I know, but very possible. And we are doing it because we have put your concerns and your health above all other considerations. It is you, the patient, that matters most to us.
At Princeton Brain and Spine Care, our priority is providing the best care for our patients. For this reason, we offer a variety of minimally invasive techniques that we feel are scientifically proven, but avoid others that remain unproven or are not right for a particular problem. We only adopt new techniques when their safety and quality are clearly proven. However, once these proofs have been provided, we're at the forefront of adopting new technologies and techniques for the benefit of our patients.
I've worked in several medical models, private hospitals, government-sponsored health care, and private practice. Never have I worked with a group more focused on the well-being of the patient than Princeton Brain and Spine Care.
Brain tumors. It is a distressing experience for a patient to learn that he or she has been diagnosed with a brain tumor. However, each year researchers learn more about brain tumors and the best way to treat them. And the prognosis for many tumors is better today than it ever was. Each brain tumor is unique, and always remember, your doctor will be the best source of information about your specific condition and its prognosis. Brain tumors are abnormal growths of new and unnecessary cells in or on the brain. It is thought that tumors occur when genetic factors or environmental damage impair normal cells so that they multiply and divide quite rapidly. There are many different kinds of brain tumors which are classified in different ways depending on where the tumor originates, how quickly the tumor grows, and how destructive the tumor actually is. Brain tumors are usually classified as either benign or malignant. Benign tumors tend to be slow-growing clusters of cells that rarely spread. Tumors are classified as malignant when they grow aggressively, invade other parts of the body, cause damage to critical functions, or life-threatening. Malignant tumors are also known as cancerous. Both benign and malignant tumors can be treated, and oftentimes there are multiple options for patients to treat these tumors. Although these classifications can be helpful, diagnosis and classifications of tumors do change. What happens if my doctor recommends surgery for my brain tumor? The goal of surgery, whether the tumor is benign or malignant, is to remove the tumor completely without injuring normal brain tissue. Even after surgical resection or excision, some tumors require non-surgical treatment such as radiation or chemotherapy. Important considerations to include are where the tumor is and whether the tumor is sensitive to radiation or chemotherapy.
The most exciting advance in intracranial neurosurgery is the use of image guidance to make brain surgery even more accurate. Through the use of little red lights, infrared lights that is, we use a global positioning system to guide a surgeon through a difficult case. Through the use of an optical camera and digitized instruments, a computer can show a surgeon where to go. This is particularly helpful in difficult cases where normal anatomical landmarks are distorted and the surgeon can have difficulty in knowing precisely where they are. This is almost like radar guiding a pilot through a stormy night with an instruments-only landing. For both brain and spine surgery, another exciting area is telemedicine and international telemedicine. At St. Mary and at Princeton, we have an internet link where I can demonstrate delicate brain surgery under the microscope and video conference it in St. Petersburg, Russia. The converse of this is true, and we are developing international consultation services where neurosurgeons in remote areas can do a video consult with me and I can advise them on certain difficult medical situations.
To Princeton and beyond, WZBN TV News. We've got you covered.
I'm Tony Cornish Jr. In our top story, Princeton Health Systems comes to the aid of a man in need of a life-saving operation. My colleague Callie Carter is standing by in Princeton Township with the heartwarming story of medical professionals coming together to save the vision of a man who lives many miles away from our shores. Callie?
Here at the University Medical Center at Princeton, a group of doctors and community members pulled together to help out a man in need thousands of miles away and that they had never even met before. And they did manage to bring him here to the medical center to perform a life-saving procedure. 26-year-old William Hoppe was back at the hospital today for one more once-over with the people who helped save his life. But William's trip to the medical center is not your average story. It begins thousands of miles away in Ecuador, where he was in a severe car accident 8 months ago that left him with an aneurysm in his brain, a life-threatening condition that his doctors in his home country could not treat, so they sent him home where he would likely either become wheelchair-bound in a vegetative state or would die. But all hope was not lost. Little did he know a group of people he had never met would come to his side. His father-in-law, who lives in Hightstown, asked a local priest for help, who then reached out to Dr. David Abelos, who has been working for years with Robbie Alexander, bringing healthcare services to the Latino community.
I immediately thought of Robbie, whom I've worked with, and so then Robbie right away said, okay, let's look into this.
And that's when things really got rolling.
The second Robbie approached me, I felt like he was my patient, and I needed to take care of him, and I needed to get him well.
With his 4-year-old daughter and wife in mind, William traveled to Princeton in June, where Dr. McLaughlin had assembled a team of 5 doctors who all donated their time and skills to perform the procedure that had never been done at the medical center.
When William had his accident, there was a tearing motion to the vessel, and that tearing caused a weakness, and that weakness grew into a balloon. And you can see the balloon on this x-ray here. And the problem with that weakness is that if that balloon ruptures, it's a life-threatening problem.
But the team of doctors, which included a specialist, Dr. Michael Horowitz from the University of Pittsburgh, managed to obliterate the aneurysm through a minimally invasive procedure using a catheter to fill in the aneurysm with several coils and then using a stent to protect the vessel. But the difficulty was not in the procedure alone. The group had to get the doctor from Pittsburgh a temporary license to perform the operation in New Jersey. And of course, they had to get William from Ecuador, which meant obtaining a medical visa.
Just through a persistent effort and dogged determination, we got everything through and we got him over here.
And the 90-minute procedure was a 100% success with no complications, but William will have to return in a few months to repair damage to his eye previously caused by the aneurysm. In Princeton, Callie Carr, WZBN News.
If, after non-surgical treatment, the patient still has intolerable pain, or if there is evidence of neurologic deficit, then we may recommend surgery to treat the disc herniation. To relieve nerve pressure and leg pain, surgery usually involves removing part or all of the disc, called a discectomy. At our practice, this procedure can often be done utilizing minimally invasive techniques. Minimally invasive surgery uses smaller incisions and specialized technology such as microscopes and endoscopes, which are mini video cameras, in order to visualize the disc. Microdiscectomy and minimally invasive techniques often result in quicker patient recovery times compared to traditional techniques, as they reduce the amount of trauma exposed to the muscles and minimize blood loss during surgery.
Probably one of the best advances in spine surgery is the use of working tubes to make surgery less invasive. Nowadays, I can take a tiny incision the size of a dime and work through a tube under a microscope to perform a discectomy. This approach is the same as it was 20 years ago, only through a smaller incision and less pressure on the muscles. This translates into less disruption of the normal anatomy and preservation of more normal tissue. What does it mean for patients? Less pain and quicker recovery.
Well, as soon as I met Dr. Shaw, my first impression of Dr. Shaw was just wonderful, because he's the only surgeon I've ever visited in my life who came right out to the waiting room and introduced himself, and that made a big impression. And so during the visit with Dr. Shaw, we were able to look at these things that were available. He put them up on the wall, and he told me what my options were.
And the experience with Dr. McLaughlin himself being very personable as well as professional, a very good bedside manner and rapport. When Tony was in surgery, every hour the nurses would call me from the operating room to update on how well he was doing. And I think that was really another good plus, being kept up to date every hour and just knowing that he was in very good hands.
Hello, my name is Dr. Mark McLaughlin. I'm the medical director.
Hello, my name is Dr. Neuralgia. I am a physician at Princeton Brain and Spine Care. At Princeton Brain and Spine Care, we have built a
When you're referred to a specialist, you expect in-depth knowledge and expert insight into your condition. When you're referred to a brain and spine specialist, you expect even more. At Princeton Brain and Spine Care, the premier neurology practice in New Jersey and Pennsylvania, you'll find world-class physicians with extensive expertise in state-of-the-art treatments.
A neurologist is At Princeton Brain and Spine Care, our priority is providing the best care for our patients. You have people whose lives are shattered. They are considering suicide. Their marriages are falling apart. They can't have relationships, and they're absolutely miserable. And you go ahead with this one procedure, and you give them their life back. And it's a very special feeling.
Thank you, Dr. McLaughlin, for making our lives a lot more comfortable and easier. Thank you.
But the man is so unique. And it just brings everybody to him. He looks you in the eye when he speaks to you, and he listens. And it makes you feel, hey, you know something, I really have such great value in this man. And so therefore you trust him with everything.
Thank you so much. He really understands. He really understood me, and he really took a lot of time to listen to what I had to say, because I know my body really, really well, being an athlete, and I just really appreciate all that he's done to help me.
He really got me feeling good, made me confident that I was going to get all the feeling back in my legs, which I did. Today I walk fine, I can feel everything in my feet, which I couldn't feel before. I can go to the gym again, I can walk normally. I just saw a friend of the family the other day, and she said, I can't believe the improvement that you've made since your surgery, because she saw me before, during, and after my hospital visit. So it's just, I'm really happy to have had Dr. McLaughlin as my surgeon.
It's difficult because it's to indicate when someone really saves your life and puts you back on a track where you can work, you can walk, and you can be healthy again. Thank you.